Today we're here talking with Victoria Elliott, the new Executive Director of the American Neurological Association. So Vicki, I want to welcome you to the ANA. We're so excited that you have joined us and our team. Do you mind telling me just a little bit about yourself and your background?
Sure, Dr. Feldman. Thank you so much for the opportunity. And I, too, am quite excited about working with the American Neurological Association. So I'm a certified association executive. I have been in association management now for 17 years. Previously, I worked in pharmacy. I have a BS in pharmacy, where I specialized in pediatrics and hospital administration before I made the career switch. My experience is primarily with professional associations, largely in the healthcare arena. My first association was the Pennsylvania Society of Health System Pharmacists. And then when I started working with association headquarters, ANA's new management firm, I assumed responsibility for the Society for Biomaterials and then moved on to the Attention Deficit Disorder Association. And most recently, I've been working with the Dermatology Nurses Association.
So Vicki, tell me a little bit about the team that you've assembled for the ANA. We're very excited to hear about them.
When ANA was presented and we talked about me being executive director, it became immediately apparent that I had to assemble a team. Your contract with our company, outlines what that team should look like, but it was my job to assemble the right skills and individuals. So on the team, we have a director of membership and education, Jessica Keenan-Smith. Jessica actually been with the company now for a little over a year. Her experience prior to this being with the American Society of Hand Therapists, where she supported most of their educational program development. She's very excited to be a part of the team and has a particular personal interest in the field of neurology. We are also supported then by a director of membership who also serves as our administrative assistant, Jackie Wozneski. Jackie comes from an academic background, also spent a lot of time in development with a previous nonprofit, and is just thrilled and has already jumped in and taken over a lot of responsibilities, as you know, and just couldn't be happier. In fact, departing the office one day last week, she said, "I'm so happy to be here." So she's actually a new employee at association headquarters and new to ANA. We're also supported then by a full-service accounting department, a web department, and some other support services like creative that we will be tapping into for ANA's benefit. We also have a marketing communications team that will be integral in our rollout of your membership and marketing plan. In addition, we're supported by a meetings team, which is comprised of a meeting manager, Astrid Schreier, who actually has several years of experience now with her company and is a certified meeting professional. And she recently hired a new meeting coordinator to assist her, Stephanie Zuba. And both Stephanie and Astrid have completely dived into the plans for the annual meeting, working very closely with the chair, Dr. Mobley, and are excited to meet everyone in New Orleans this fall.
So tell me, what excites you most about being the new Executive Director of the ANA?
I would say that what excites me the most right now is this unique opportunity that the ANA has created for itself by opening membership to all of academic neurology. You're sitting on a large number of prospects who need to understand why it's so important to be a part of the ANA and learn about all the opportunities you're providing for career development, research support across the spectrum of academic neurology.
Vicki, what do you see as the major opportunities for the ANA moving forward?
I think the major opportunities for ANA moving forward are significant membership growth, maximizing strategic partnerships, and creating a brand around this new member opportunity that really resonates with members and prospective members and helps them understand why it's important and relevant to be a part of the American Neurological Association.
Thank you very much for joining us today, Vicki. We're very excited to have you on board. I want to welcome you and your team to the ANA.
Dr. Feldman, thank you very much for the opportunity. I so look forward to working with you and the entire council and all of ANA to move your strategic plan forward.